السلام عليكم. النهارده هنتكلم على الرايم فريم ورك. الرايم فريم ورك ده عباره عن تول. التول دوت اتعمل علشان تمونيتور اول حاجه علشان تو ليرن، يعني تو ليرن ذا ستودنت اند تو مونيتور ذا something، يعني مش مشكله. If someone of us learning anything, he must find a tool to evaluate what is learned. So this RIME framework is invited or created to follow up what is learned throughout certain time, ممكن 1 year, 2 years, 3 years, and evaluate the person and how much he gain and acquire the knowledge. So the RIME framework is a tool for describing and monitoring student progress. This RIME framework is developed by Dr. Luis Bangaro, and this Dr. Luis Bangaro is an internist and medical education expert at Uniform Service University of the Health Science. So who can use this RIME framework? The RIME framework provides terminology for describing professional growth of medical student. It is used in much lecture across the country. Students can use it to monitor their own progress, and resident and faculty can use it to monitor student progress and to provide appropriate feedback. So the framework, what is the framework sites? The RIME is practice of medicine is integral performance of at least 4 roles. The one who just do the role of RIME put it in a frame of 4 words, at least 4 words. The reporter, interpreter, and manager educators describe behavior, skills, and attitude, divide each role, guide learner and expectation, and anchor formative feedback. So what about the reporter? Reporter can accurately and reliably gather clinical information. Gather and just collect the information that he took it from something, from the patient, from institute, and anything. He just collect information, gather clinical information. If we are just talking about clinical practice, we just gather clinical information. Reporter can communicate clearly. Reporter can communicate clearly the clinical information they have obtained. Reporters are able to distinguish important information from unimportant information and are able to focus data collection and presentation on central issue. It is expected that all students will function as a master reporter by the end of the clerkship. Suppose that I just take a history from the patients. What's your name? My name is Mr. X. How old are you? I'm 46 years old. Where are you from? I'm from Cairo. What did you have? So what's your clinical? What's your complaint? I'm just have chest pain. All what I take from the patient, I just put it in the paper. So I just collect the data. This is the function of the report. The other thing, I just distinguish between the important thing and unimportant thing. This clinical data is very important and this clinical data is unimportant. So this is the function of the reporter. So what about the interpreter? Interpreter are able to identify problem independently and to prioritize problems, including new problems as they arise. Interpreters are able to develop differential diagnosis independently and to make a case from and against each of important diagnoses under consideration for a patient-centered problem. Helping students make the transition from reporter to interpreter is one of the focal efforts on the clerkship. All students are expected to show significant progress in the area. Students should be continued making progress in this stage during the rest of their third year's clerkship. So after I'm just gathering the information in our practice, this is clinical information. I must be able to identify the problem and just arrange what's important and what's less important. And after I just know all the problems, I make a differential diagnosis. Manager able to develop and define a diagnostic and therapeutic plan for each of their patient-central problems, able to utilize their broad clinical judgment to decide when action needs to be taken. Manager can be analyze the risk-benefit balance of specific diagnostic and therapeutic measures based on individual patient circumstances. While some students will be acquire sufficient knowledge, skills, and confidence to function as a manager for some of their patients, the later part of the clerkship, not all will make this transition. So the main function of the manager is to do a diagnostic and therapeutic plan for the patient, or after taking the clinical information, and after that he decide and decide what's action will be taken, and analyze the knowledge that he took it and make a risk-benefit balance for the patient. All the previous stage from reporter, interpreter, it should be a transition zone. The interpreter must be transformed to the reporter must be transformed to interpreter, and the interpreter should be transformed to manager. At this stage, not all the student will reach to this stage. Educator have a mastered and fundamental skill describing above. Educator have the insight to define important question to research in more depth, the drive to seek out of the evidence behind clinical practice, and the skills to enable the student having a quality of this evidence. Educator take a share in educating the rest of the team. Again, the transition from the manager to educator is usually completed during internship and residency. So the reporter function is to gather and report the data. Interpreter interpret the information from the patient lab history, applied medical knowledge, and weights evidence. Manager organize and manage information and resource, provides differential diagnosis with respect of evidence, suggest appropriate consideration for plan of care. And finally, educator articulate what is known, determine what is need to be known, convey medical knowledge in understandable terms to the patient and colleagues. Summary: the RIME model provides a framework and terminology for describing the professional growth of medical students. Students should use it to monitor their own progress and resident, and faculty should use it to monitor student progress and to provide appropriate feedback. Thank you.
stop.
stop.
Aphasia.